Okay guys, we're going to attempt to demonstrate the intraoral exam now. This is going to be just a little harder as there's those kind of hard to see structures, and we're going to do the best we can to go over those with you, but use your pictures, and then once we get on partners and we start looking into them, write those questions. What do you have questions about? We're going to identify these on our patients. So again, I'm going to just explain to my patient. I'm going to do the intraoral part inside your mouth check, and I'm going to make sure that's okay with them and clean them up. So this part, of course, is done with your patient in a supine position. Now, at this point, I would put glasses on my patient. Remember, for the extraoral exam, I'm going to take the glasses off my patient. If they have glasses, I don't want anything obstructing what I'm looking at. But imagine she's got glasses on to protect her eyes from the light, and plus just anything else. All right, so remember, again, we're going to palpate the lips, the buccal mucosa. I want a good look. Remember the PowerPoint picture of the man stretching his mouth? That's what I'm going to kind of do to my patient. I'm going to have her open, and sometimes the first thing I'm going to do is have her bite down. And when she bites, this allows me to really stretch and take a good look. Pull that lip down. Pull that cheek out. Pull that lip out. Have your patient turn towards you a little bit and really take a good look. Now I'm going to have my patient open, and I'm going to bidigitally palpate her lips. I might come over here and with my palm palpate the buccal mucosa. I can do that to the side here. Remember, I'm trying not, my fingers are in my patient's mouth now, so what I don't want to do is wipe their saliva all over their cheeks. So I'm going to be very cautious of that and use either backs of my hand or palms, but we're going to make sure we palpate everything. All right, you are going to have to tell me what is the free gingiva, what is the interdental gingiva, what is the attached gingiva, and what is the mucogingival area or junction, okay? So those are going to be three things. You'll just take a little Q-tip like this, and you'll point out to me to make sure we understand what we're looking at. We're going to be using the Q-tip a lot as a pointer as well. So you guys will have a mirror. So the next thing I'm going to do is I'm going to, after I've looked at her buccal mucosa and I've looked at her lips and we've palpated, I'm going to look at her palate. And so with my mirror, I'm going to scan the hard palate. I'm going to peek at the soft palate. I'm going to palpate it. This might tickle a little bit. I'm going to tell my patient as I come over here and palpate. And then you guys are going to identify some structures for me. You're going to come over here and point out the incisive papilla, the rugae, the median raphe. If your patient has fovea, then you'll point that out. I don't see some real distinctive fovea in Miss Pisano, so we might not see it on everybody, but it's going to be kind of back towards the soft palate, hard palate, where those two come together. Do you guys, and you might not be able to see, but she's got a small torus on her palate. And that's one of those things that you're going to have to be able to identify in Clinic 1. For the buccal mucosa, you would also identify if she had linea alba, right? Which I don't really see a lot of signs of linea alba. But let's see, what else on the palate? I think that's all you guys will have to identify as far as the palate goes. Okay, once I've evaluated the palate, I'm going to also, while we're on the maxillary, I'm going to look at her maxillary tuberosity, and I'm going to palpate, and I'm going to use my mirror to look at both sides and palpate. I'm going to move down to the mandible now, and we're going to do the same thing on the retromolar area. I'm going to look with my mirror, and I'm going to palpate. I'm going to have my patient lift their tongue to the roof of their mouth, and I'm going to come over here, I'm going to push, filling that sublingual gland. Also, I'm filling for mandibular tori. Feels pretty good. And that would be it for the mandible. Now let's take a look at her tongue. So I'm going to have my patient stick her tongue out. You guys are going to be required to identify the types of papilla on the tongue. So you will identify the white filiform papilla. You're going to come over here and look at your patients as the like red mushroom top fungiform papilla. You're going to look at the sides of your patient's tongue for the filiform papilla, kind of more of these vertical lines here. And then we're going to identify without gagging our patients if we can see the circumvallate papilla all the way in the back. All right, I also want you guys familiar with the base of the tongue and the structures that sit at the base. Now, I said we probably wouldn't see those very well, but behind those circumvallate papilla, we have the sulcus terminalis, the little V, and then right in the middle of where that V sits, we have the foramen cecum. So we're not going to get a very good look. We can't see that very well, so we're not going to gag each other to see it, but look at pictures and know what I mean when I say those structures. All right, so more for the tongue. Let's look at the ventral side of the tongue. That's the dorsal side. Let's look at the ventral. The ventral side of her tongue, we're going to identify the pilicae fimbratae. See the little, I guess you can call them hair-like structures or projections, that they're just loose skin, kind of like if you follow a lingual vein. We've got the lingual frenum. You can see the little veins and vascularity under the tongue. We're also going to identify those Wharton ducts that drain the submandibular glands, find out where they are, and actually those little ducts sit right on top of the caruncle. Okay, so you'll identify that as long with the sublingual folds. You can see this little wave. It looks like a little wave of tissue right here on both sides. That is your sublingual fold that you'll identify. And then, as I've kind of already demonstrated, you'll palpate all this area. We're not done with our tongue just yet because we talked about a really critical area, especially for finding oral cancer, is along the lateral borders of the tongue. So I'm going to have my patient stick their tongue straight out at me. I'm going to lasso it, and I'm going to have them open wide, and I'm going to pull gently on their tongue until I get a nice view of everything on the lateral side. I'm going to do the same thing for the other side. And notice I'm using my mirror because I cannot see very well. And so I want to make sure I've seen up and around the tongue as best I can. We're going to palpate everything too. Okay, making sure there aren't any scarring. It's very common that there'll be a piercing scar from a tongue ring or something else. While we're here, we're going to also look at her salivary function. So I'm going to have her lift her tongue to the roof of her mouth. We're going to start with those submandibular glands at the Wharton duct, and I'm going to dry it. And then this is where I was saying we milk it. And so with my Q-tip, I'm just going to kind of try to irritate it. If I don't see a response, I'm going to tell my patient, think sour Skittles, lemon heads, anything that you might think, sour pickles, and we're going to see. And look, that worked. We got a little bit of saliva function. So it's funny how that does work. But I'm going to evaluate it. If I'm getting slow response, I'm going to write slow. If I'm getting no response, or maybe minimal or light salivary function, that's just something to tell me, like, let's evaluate the saliva a little bit more. Do I see it pulling? We're also going to do the same thing, you guys, for those parotid glands. So you're going to stretch your patient's cheek out a little bit. Notice the Stenson duct here. And actually we can see it really well in Miss Pisano. And we're going to do the same thing. So I'm going to dry it. And then with my Q-tip, I'm going to go and see if I can get a response. And that one responded pretty quick. So you're just looking for this kind of glossed over wet look. Sometimes you'll actually see a little bit of saliva come out. And you know, it should only take a few seconds for it to respond. So if it's taking a lot of tries, we can say delayed. All right, fine. Also, I shouldn't say finally, we got a couple more things to look at, but I want to check her oral pharynx now. So again, this can be easily viewed on some patients and not so easily viewed on others. I do want to be careful not to gag my patients, but I'm going to have them open as wide as they can. I'm going to use my mirror to kind of hold their tongue down if necessary. She does this very nicely, so I'm not probably going to risk gagging her with my tongue. I'm looking at the uvula, the anterior posterior pillars, the tonsils. We can also check the pterygomandibular fold here at this point. I'm going to have my patient say, ah, perfect. And just get as good of a look back in those fauces, that oral pharynx, as I possibly can. Looking for redness, obviously swollen tonsils and large tonsils, anything of that sort. Once I've got a good look of that, I'll have my patient just kind of close. And then at EOIO, we check their occlusion. So this is something you're going to have to review a few times, but when you see it in your patients, we get to apply it now from our pictures. So it's kind of fun. We're going to have our patient bite down, and I'm going to stress in your normal bite on your back teeth. And we're going to look, she's got her first molar, so we're going to look at that cusp, that mesial cusp, and see how it lines up with the buccal groove of the mandibular teeth. So Miss Pisano's mesial cusp lines up very nicely with that buccal groove. So we're looking at a class 1 on the right side. We're going to come to the other side and we're going to do the same thing, which appears she has a class 1 on the left side as well. Now remember, I talked to you about normal occlusion, class 1, class 2, and class 3. Normal occlusion is your class 1 with no other shifts or changes in the teeth. Look how everything fits together super well. She doesn't have anything out of place or lingual verted or rotated, and so she would be what's considered a normal occlusion. And remember, we talked there is a class 1 malocclusion where you might have this class 1 development on the molar relationships, but maybe we have teeth that are rotated and misaligned in other ways, okay? So after we get her occlusion, also too, I just might as well put, since we're on the video, is she could have a class 1 on the right and she could have class 3 on the left. So we're going to classify right and left. I'm also going to take a look at her overbite, and I'll have to show you guys how to measure that at another time, because you would have your probe and you would just try to line it up and take a measurement of the incisal edge. Everyone's going to have this slight overbite. We're looking 1 to 2 millimeters possibly, because those teeth come out and over. So she's got what looks like a fine overbite, but I would still measure it. And then remember, her overjet is the horizontal space between the teeth and how far her top teeth come out from the bottom teeth. That would be her overjet. Or in some cases, people with like an underbite, like a bulldog, might have an underjet that we have to take into consideration. So we'll look at that, we'll measure that, we'll look for any cross bites, open bites, and then we're going to evaluate her midline. And so I'm going to come right here and look at her midline between 8 and 9 and see how it measures up with 24 and 25. And so sometimes you got to take a pretty close look at this. I feel like she matches pretty well, maybe deviated a little bit to her left. If I'm looking at this midline and how it compares to the lower. What do you think, Miss Pham? Do they look right on to you from that angle?
It looks deviated to the left about 1 millimeter.
Deviated to the left about 1 millimeter. So we will check their midline deviation as well. All right, you can go ahead and close and relax. All right, I think that's about it for an intraoral exam. I'm going to thank my patient. We'll write up our notes. I'm going to show you where we write this in the clinical note of our charts in EagleSoft, what we fill out. But as far as the procedure, you want to make sure you get all those structures and can perform this for me on Thursday. All right, good luck.